Hey everybody, welcome to the Allied Health Showcase. My name is Mattie and I am super excited that you all are joining us. We've got Emmy off camera who's running the technical side of things, and she's also monitoring your comments. So be sure to put in the comments where you're watching from, who you are, maybe what programs you're interested in, and go ahead and give Emmy a shout because she's awesome. Just so that you know, to comment, you probably have to be signed into a Gmail account. So if you aren't able to comment, that might be the reason, but we can figure it all out as we go. Again, just let us know any questions you have, where you're watching from, or maybe who you're with. I know we've got some classrooms out there, so big shout out to you. We're gonna go ahead and get started. You guys are gonna see a lot of cool things today with our allied health programs. You're gonna see some videos from instructors, also some students. You're gonna get an inside look at our programs, our lab spaces. But just so that you know, as a disclaimer, we have recorded some of this prior to the COVID pandemic. So some of this video doesn't have masks and things like that. That's because it was prior to COVID. So just know that here at ECTC, we are following all of our Healthy at ECTC guidelines to make sure that campus is as safe as possible. Now that we've got some of that stuff going, let's go ahead and get into it. If you didn't know, our allied health programs, 4 of them, are what we call selective admission. Selective admission means that they have a separate admission process from ECTC's general admission requirements. Those selective admission requirements often include an application, completion of prerequisite courses, and attendance of a pre-admission conference. Each program's admission requirements are a little bit different, but generally speaking, students with a high likelihood of acceptance are those that are driven to study and succeed and show a particular interest in the biological sciences. They're passing those prerequisite courses, and they're also students who have met benchmark in those reading and ACT scores and in those exams. If you requested the link to this session prior to right now, us being live, you received a fact sheet that lays out all of those selective admission allied health program requirements. If you're catching us on the replay, requirements for each program, you're still able to see those on our program pages. Those are listed on those pages. You can go to our website and then under the Education and Training tab, find the program that you're interested in pursuing, and all of that information for admission is located there. You'll hear a lot of that information also from our instructors today, but you're probably already tired of listening to me talk, so we'll go ahead and get into it. Our first program is Diagnostic Medical Sonography. This is our newest allied health program, and it now has graduates that are out in the workforce. We had a great time sitting down with these students and learning about the different types of images that they capture with sonography equipment. You may be interested to know that sonography is not just working with moms and babies. So let's go ahead and take a look.
Our program is a general sonography program, which means students will learn abdominal and OBGYN sonography while in the program. It's 3 semesters in length, and students pretty much start scanning on the 3 machines that we have here in the lab on day 1. So it's a lot of lecture up front in the first semester, and then after about 8 weeks, most of the program is clinical. We have several clinical affiliates throughout the area, and we send 1 student to each clinical site, and they get to work one-on-one with the sonographers, and those sonographers will work with those students in their scanning skills and help them to master that skill. And they go 3 days a week, pretty much 8 hours a day. It's pretty much like a job for our students. I think sonography looks very easy when you're watching somebody do an ultrasound. You know, we're scanning a patient, we're pushing some buttons on a machine, and that's it. That's not all it is. You know, you have to be able to identify anatomy. You have to be able to adjust the ultrasound machine to get diagnostic quality images. And it's not just pregnant mothers that, you know, sonography is useful for. It's useful for diagnosing cancers on the kidney, you know, liver pathologies. All of those types of things are good for ultrasound. Will diagnose all of those things. So, you know, we want our students to talk to their patients, have a good conversation. We tell them to take good care of them. It's very important in this field that our facial expressions do not show because we are not allowed to diagnose patients. So, we work a lot on, okay, you're doing well, but you gotta watch your face. You gotta watch your facial expressions, because patients can read that, and you need to make sure that you control that. Most of our graduates are at our clinical affiliates. They were employed straight from clinical. They all talk, about how appreciative they are that they were able to go through this program. They found a job that they're passionate about and like to go to every day. Students that wants to take care of other people, that wants that rewarding career of knowing that they've changed someone's life potentially. Students that are really science-driven students are going to be students that are probably going to be successful in this program.
I told you it was really interesting. We had a blast sitting down with sonography. Also, while we were watching that video, I saw your comment, Ashley from Meade County. Super excited that you're here with us. Our next program is probably a little bit more familiar to you, and that is nursing. Our nursing students get a top-notch education here at ECTC, and our program is highly respected across the state and across a lot of medical professionals because they know that our students get a high amount of hands-on experience. In this next video about nursing, you're going to see that our nurses have really big hearts and they love what they do. So take a look.
A lot of people think nursing is just taking care of patients and doing what the doctor tells you to, but nursing is truly a job of compassion and caring. You have to be competent in your knowledge, you have to be competent in your care. You do fill out your doctor's orders, you do what you are told, you do perform skills, but there is a part of a nurse that you have to have compassion for your patients. Our nursing program, you learn the foundation of those skills, you learn the knowledge of what to look for, how to provide the management of the team, because you won't just have one patient. We have a wonderful partnership with our area hospitals, and our clinical experiences are great. You get hands-on experience. In an associate's degree program, we teach you in the lab, we show you in the lab, you practice in the lab, then you go and you do it. You actually get to put your hands on patients and be confident in these skills. In first semester, they start clinical. Right now, they go to Encompass, and they do clinical on a med-surg floor there. In second semester, they start to travel to Flagey, Twin Lakes, and then Baptist Health Hardin. And then they do psych clinical at Lincoln Trail Behavioral Health. Then third semester, you go to med-surg clinical and labor and delivery, NICU, and postpartum. Then fourth semester, you are in a solo practicum with a nurse. You are one-to-one with a nurse, and it is not an instructor-led clinical. You have an instructor that will review your paperwork, and they work with your nurse to see how you are successful. That is the best part about our program, is we get to give you a real nursing experience. Well, we have 3 dedicated nursing labs that are just our low fidelity mannequins, and then we have a simulation lab with 3 high fidelity simulators, and the high fidelity simulators are phenomenal. They can do all of the things. They will talk to you. They are hooked to monitors. You can watch their entire status change. We can make them do anything at all. You become family with your classmates. You are with them for lecture, you are with them for lab, you are with them for clinical. You will see that when you form those relationships, you build each other up and you work together, you will be successful. And that also shows how you'll work in a team environment in your career, and it all starts day 1 of the program. So when it comes to you graduating and you're out there on your own, you can look back and say, they prepared me as much as they could to provide the skills, provide the competent knowledge base, and to provide compassionate care to everyone that I see and everyone that I'm a part of their life.
Pretty cool, huh? Our nursing students are awesome, and our instructors are incredible. You can really tell that they love what they do. Just as a reminder, if you're watching us live, make sure to go ahead and put in the comments, just like Ashley did, where you're watching from, or if you have any questions that we can answer live while we're here with you, we would love to do that. Our radiography program is the next spotlight, and I'm going to tell you, I was super shocked at what all goes into the education of a radiography technologist. They are learning anatomy. They're learning all the bones of the body. They are also learning how to correctly take images that are very, very precise, and sometimes even multiple angles of the same thing so that they can get a complete picture of what they're working with. It takes a lot of precision for getting a good image, and these students are absolutely rocking it. So if the skeletal system or the healthcare field is interesting to you and you want a job that brings you something different every day, make sure you pay close attention here.
Radiography program, we teach the student how to take the x-rays that the radiologist, who is the doctor that reads the x-rays, so we give him the images. A lot of people think we just push buttons and tell people to hold their breath, but there is radiation safety so that we're not overexposing our patients. It's being able to recognize and know your anatomy well enough that that radiologist can look at those images and figure out what's going on with the patient. What's unique with our program here is our students go to clinic at the hospitals. So they do their didactic and theory here, then they go out and they start in their first semester going to the clinic and practicing on patients. They have direct supervision until they have proven competency. They also go to different sites while they are in the program over the 2 years. So they see anything from an imaging center to large hospitals to the medium size. So they get a lot of variety.
I think radiography itself is a great allied health program that is a building foundation for a student that may not see themselves exactly knowing what they want to go into at this very moment, but they want to be in allied health and they want to make a difference. I think this is a great avenue to get that foundation of radiography, and then later on they could go back for secondary education to do CT, MRI, nuclear medicine, radiation therapy. So there's a lot of opportunities for students as they age and progress into the allied health field. Our students, because we do have cohorts of students and we're together all 2 years, I really think it's more of a family-based type of program. Students make lifelong friends here, and that is something that is extremely important and very valuable for anyone looking at a radiography program, in my opinion. So not only are they getting to see different types of patients and a multitude of patients on a day-to-day basis, they are moving about in the hospital in different settings, whether that be trauma settings, the OR, patient rooms, critical care units. So that is something that makes this modality very, very special for students. If you don't like to do that day in and day out, same job, this is a great avenue for you to get to explore those types of things.
Welcome back. It looks like we have a body structures class from Meade County watching, so shout out to you guys. We're super excited that you're here. We really enjoyed sitting down with our radiography students in their labs, and by now I'm sure that you can see why. We're going to go ahead and get into our next program. Our next highlight is actually of our hospital's first responders. Those are our respiratory care students. These students are dedicated to your breathing, making sure that your airways are open, and making sure that it's possible for other physicians and medical staff to give you the care that you need. I do want to make sure to make a comment, though, about the current environment that we find ourselves in. When we sat down with these students and instructors, there was almost kind of a sense of urgency in the room. I mean, we're currently enduring a respiratory pandemic And our respiratory graduates are on the front lines of this pandemic, fighting for people to be able to breathe. And I am super, super thankful that we get to show you all this program and these students and instructors that make it so phenomenal at a time where it might be more important than ever. So I'll see you on the other side.
Respiratory therapists are the people that respond as first responders in the hospital. If somebody stops breathing or their heart stops, then you want a respiratory therapist at your side. It could mean that we're going to be doing CPR. It could mean that we're going to set up a ventilator. It could mean that we're going to draw blood from the artery. But we're doing all of that work to make sure that that person gets breathing again. We're the people that, again, you don't know you need until it's very critical that we're there. So our program, we're very proud of 100% pass rates for the CRT, which is the first level of test that you would take after you get your degree. And so the first level is CRT, and so you're a certified respiratory therapist, and we have 100% pass rates on that. And then once you get that level, then you can take your RRT. It's not critical in the state of Kentucky that you take that exam, but we very, very much encourage that. We train you to be a RRT. You do get more money for being RRT, so everybody wants more money. If I can make more money, I want to make more money. Our equipment in the lab, we're very proud that we have the ventilators that are actually being used in the local facilities. And there are lots of ventilators that are out there in the market, and some of them are not ventilators that are used here locally, but we have the ones that Hardin Memorial uses, that Taylor Regional uses, that Norton Children's uses. We get the ones that will be the same ones that you would go to when you're doing clinicals. So once you're admitted, you're with the same group of students for the whole time. So we admit biannually. 15 students will be chosen to go into a cohort, and you're with those students the whole time. So they become your family. You work with them. We eat a lot together. They become close friends as well as, again, family. If you want to be one of those 15, you really have to set yourself up with a high GPA, a high ACT score, and then getting those general eds, the math, the English, the oral communications. Better you make yourself look on paper, the better your chances are of being in our program. I keep up with all of my students, mostly through Facebook, and especially right now during this pandemic, what I hear from them is that every day's a blessing, and they're very proud to be a part of that blessing, to be able to help somebody breathe better.
Okay, so you have seen several different videos of our selective admission allied health programs, but I want to talk to you all about our allied health programs that are not selective admission. Also, I know that we have some students from Bardstown High School watching. We're so glad that you guys are with us. Make sure that if you have any questions or if you just have any feedback about what we're doing today, go ahead and put that in the comments as well. We are super thankful that you guys are joining us today. So our two allied health programs that are not selective admission that we want to make sure to talk to you about is medical information technology and health science technology. These programs are great for students who want to be part of the healthcare field in administrative, supporting, or entry-level roles. So the medical information technology program prepares graduates to be medical coders, medical transcriptionists, scribes, administrative assistants, office managers, medical interpreters, and electronic records specialists. Health science technology is a little bit different, as it's designed for those students interested in pursuing further education in the clinical side of allied health. So this program is going to prepare students for entry-level careers in healthcare facilities doing things with substance abuse recovery, our aging services, and also some medical coding, medical transcription, health records, and also medical scribe. All the information about the medical information technology and health science technology programs can be found on their respective program pages. And again, you can find those from our website, going to the Education and Training tab, and then clicking on Find Your Program, and then clicking on the program that you want to look at. Also worth mentioning, these program pages have all of their degree check sheets loaded onto the page, so you can see what kind of classes that you're going to be taking for each program. Also worth mentioning about MIT and HST is that these programs, all their classes are currently online. Also part of the healthcare field that's not selective admission, we offer nurse aid and also our emergency medical services and fire and rescue technology. Nurse aid is a certificate that can be earned as part of the prerequisite, for the nursing program. Many of our nurse aid students, after getting the certificate, go into the workforce and actually work as a nurse aid while pursuing and completing their nursing degree or an allied health associate degree. And then our EMS and fire and rescue technology students, they are training to be first responders, and many of those students are actually already providing fire, rescue, and EMS services in their community, but they're wanting to obtain a full associate degree for advancement, additional training, and to get some more certificates under their belt. Information on all those programs, again, can be found on their website. On our website, on their program pages. So if you've seen anything today so far that we've talked about that really piques your interest and you agree that ECTC is the place to start your path to a better life, there's a couple things that I want you to think about. So first is the application. We are an open access institution, meaning that we don't require a minimum GPA or ACT score to be accepted to the college. Also, our application's free. So go ahead and get online and fill that out. The next step you're going to be thinking about is submitting your transcripts or your test scores. So transcripts are any high school credit you have, also any college credit that you have, and then of course your test scores, and then you're going to be applying for financial aid. That is with your FAFSA, and after you do all that, you're going to be what we call ready to enroll, meaning that you will set up an advising appointment with one of our master advisors who are able to talk to you about building a schedule that works for you, that works towards pursuing the degree of your choice. If you're still contemplating, take into consideration some other factors while you're examining your next steps. ECTC might be a good fit for you. No matter the program you'd like to pursue, ECTC has small class sizes. You're getting more one-on-one help and more one-on-one attention with an instructor and those advisors. We're close to home. We have 5 campus locations. So whether you're in Meade County or Grayson County or E-Town or other various locations, we're close to you. Also, we are so much more affordable than a lot of other places, especially with scholarship opportunities like the Work Ready Kentucky Scholarship. I couldn't sit with you guys today and not talk about the Work Ready Kentucky Scholarship. All of our selective admission programs in the Allied Health Department are covered under the Work Ready Scholarship. Once you are admitted to one of those selective admission allied health programs, or MIT or HST, you would be eligible for that Work Ready Kentucky Scholarship with a couple of other requirements. And that scholarship is designed to eliminate the gap for students between educational training and obtaining a job in that high-wage, high-demand sector. You're going to apply for the Work Ready Kentucky Scholarship, and then after your FAFSA money comes in or any other scholarships you have, whatever your balance of tuition is, Work Ready, if you're eligible and you get that scholarship, they're just going to go ahead and wipe out the rest of that tuition and pay that, so school and college can be affordable for you and you can go ahead and get into that dream job. Now, I've talked a whole lot today, and again, if you have any questions, please reach out to us or put those in the comments. But right now, I really want to take some time for you all to hear directly from our students. You also may see some familiar faces, so go ahead and check out what our students have to say.
When you take an x-ray, you're not just someone who's taking pictures. There's a lot to do with dealing with the patient's anatomy, thought process, and dealing with just the hospital procedures in general. When you go in, you got to know anatomy. You're not just looking at someone's body and taking a picture of their arm or taking a picture of their hand when they break it. there's a lot you do assisting the actual radiologist. You're kind of his right-hand man, and however well you perform is going to determine how well the patient's outcome is. I took a break, found myself, figure out what I wanted to do, and ECTC is helpful if you're a high school graduate or if you're 40 years old looking to find a new career. Once I decided what I wanted to do, they didn't talk about my past, classes I dropped, classes I didn't finish. They were just solely focused on what I wanted to do in my future. I actually have the Work Ready Scholarship. So the Work Ready Scholarship pays for all my tuition. I do pay for my books, but a small fee of $300 to $400 for books compared to $2,500, $2,800 with tuition saves you a lot of money in the long run. And actually the whole program I have not had to take out a single loan.
I love the variety of sonography. I think going into it, I was open to the idea of abdominal or OBGYN or vascular sonography, but being in a hospital right now at my clinical that's mostly abdominal sonography, just the variety alone of everybody's got a different issue, but everybody's anatomy is so different on the inside. It's really challenging, but it's really cool to be able to see all the things we can look at and how we can help that person. Honestly, for the first clinical, I was intimidated. You're kind of thrown in a little trial by fire. You get into that job setting and you can't really tell based off scanning your classmates in the first 2 months of class whether I'm going to be able to do this. But I love clinical. My last site was great. The one I'm at now, it's hard, but I am finding that I really like it and always learning so much, always learning. Come be part of this program for Aaron Burns and Lydia Wenzel alone because they are wonderful and they have changed my college experience. They just love us and they want the best for us and they are always checking on us, always asking, if you need to talk to anybody, come to me. And that's just something you're not going to find anywhere else. That has been the biggest part of my education here for sure.
Basically, I've always wanted to help people, and one of my friends had some health problems, so I got to kind of work with respiratory therapist and physical therapist and occupational therapist, and respiratory just kind of jumped out at me, and that's why I chose respiratory. I would like to eventually be a travel RT, so maybe travel around the country. You need a little bit of experience, so I'll try to get into a hospital locally and work for about a year or so, and then hopefully travel. I went to UK before, and it's 300 students in a class. You don't really get to know any of the students. So with a smaller group of people like here at ECTC, it's a whole lot better. You get to know everybody. You can help each other out and things like that. I'd say, for one, I'd say it's okay if you don't know exactly what you want to do. I'm older. I've been out of high school for 9 years. I'm just now finding out what I want to do. Respiratory is a great program. You get to do a lot of different things. So maybe give that a consideration. Yeah.
I picked the nursing program because when I first went to college, I went to Western and I studied chemistry, but I worked at the hospital and I saw how nurses worked, and I was a phlebotomist and I was like, that's really cool. I want to do that. So that's why I transferred to ECTC. Clinicals is fun, but it is stressful, of course, but you learn all the skills in class and you don't know how you're going to use them, but when you're in clinicals, you apply them, and it makes a lot more sense when you do it, and it's a lot of fun. My advice would be to take a career quiz. That's what I did. Job shadowing is really fun. I wanted to be an orthodontist, so I shadowed there and I was like, I can't do teeth. But just job shadowing, and when you think of nursing, don't just think of med-surg, like giving medicine, whatever. There's so many different opportunities. You can do doctor's offices, you can work in a hospital, of course, you can be a travel nurse and go to California and make big bank. There's so many opportunities you can do with nursing.
Don't you just love seeing all of that stuff from our students? Big shout out to them for being rock stars and just really pushing through all the uncertainties of the pandemic and everything right now. They're doing absolutely amazing. We're so thankful for them. We're thankful for our instructors and everybody else who made Allied Health Showcase possible. Also, just a last plug, if you have any questions or you're wondering about anything or you want to go ahead and take those next steps towards being a student at ECTC and pursuing an allied health degree, please don't hesitate to reach out to us. You can reach out to me directly, or you can reach out to our recruitment department at ectcrecruitment@kctcs.edu. Emmy's going to go ahead and put some of that contact information in the comments, probably after we're finished, so go ahead and check those comments afterwards just for that contact information if you need it. Thank you all so much for joining us here for this session of ECTC's Allied Health Showcase. It's been a blast hanging out with you all. I'm so excited that several of you were here and commented where you're watching from. It was great to look into some of our Allied Health Showcase, or Allied Health programs, with you during this showcase, at programs that are producing today's healthcare professionals. That's it for me and Emmy here, but hopefully we'll see you soon. Thanks.